I did this because this is my passion. I love health and fitness.
But certified trainer Dave Stillwagon won't be wearing his Health First Pro Health and Fitness Center ID anymore, where he worked more than 6 years and was a member for 14. It's all because Stillwater decided against getting a mandatory flu shot by the Health Network's December 15th deadline and lost his job.
I don't drink, I don't smoke, I don't take drugs by choice. I also make the choice that you can't force drugs into me.
So could you be fired for refusing a flu shot? And why is it every year at this time we are forced to deal with those who have never gotten a flu shot and still insist they don't need it? Welcome back to MidPoint. Newsmax Deputy Health Editor Nick Tate joins us here in the studio. We bring this to your attention here because we have that story, and then at Boston's Brigham and Women's Hospital, they're being sued by the Massachusetts Nurses Association over a policy that demands that everyone take an annual flu shot if they wish to keep their jobs. Right. And it's against the one rule, so it's against the state regulation, so you could be fired. It's so interesting. People don't want any drugs in their system.
That's right. Well, you know, the thing here with flu is that if you're working in a healthcare facility, you are going to be exposed to a lot more people who have the flu, and theoretically you get it, you pass it on yourself. And so the argument that health officials will make is that people who work in healthcare settings should be vaccinated. But there's no federal law and there's no state law that requires it. So what's happening in these individual cases is that the nurses at Brigham and Women has taken a policy in Boston that the nurses must be vaccinated. There is no federal or state law that is requiring it. They're taking that policy as a private institution, and other healthcare facilities are doing the same. And some people, like the nurses at Brigham and Women and the gentleman we just heard from, are saying, wait a minute, you can't tell me what to do in terms of taking medication and protecting myself. That is my choice. Complicated issue because flu is not 100% effective. It is recommended for most people over the age of about 6 months. And it is probably the strongest weapon that we have to fight flu, which kills about 30,000 people a year, but only about half of the population, fewer than half of the population, actually get flu shots. The truth is, doctors and nurses, you can see from this list here, 90% now get it voluntarily. The question is, what should be done about those additional 10%? And a lot of folks argue that this is a free choice issue.
Okay, here we go. 2-minute warning now. What about those people who say, I don't get a flu shot because I see all the side effects that people suffer, and I'm not going to get sick?
Well, if you believe the science, the side effects are minor for most people, and they are very, very rare. They tend to be irritation. Some people have soreness. Some people can have a slight fever in the first couple days, but they're mild in comparison to what actually happens when you're infected with the flu. And I can tell you from personal experience, for many years I didn't get a flu shot, and then about 15 years ago I got the flu, and a flu is not just a bad cold.
Ah, there you go. Big difference.
So you can be on your back for 7 to 10 days, unable to work. That is a much bigger impact on folks than some redness and some irritation. I should point out, though, that it is not 100% effective, and that's one of the other arguments that's made against by folks who say the flu shot is not a cure-all. But it is a big factor in protecting against flu. There are other things you can do. You can boost your immune system by eating well, managing stress, exercising, doing all those things that we know about. But you know, the flu vaccination, if you believe what the scientists tell us, is a tremendous weapon against the flu.
Anybody who should not get a flu shot?
Yes, if you are allergic to eggs. Flu is incubated in eggs, and so you can have reactions. And there are some people who have particular genetic makeups that make the flu vaccine not for them if they've had bad reactions in the past. But the best thing to do if you're in that situation is consult your doctor and say, should I or shouldn't I? And then you should be able to make a reasonable decision on your own unless your employer is telling you what you should and shouldn't do.
Flu shots all the same, though, if you get them at a convenience store, you get them at the pharmacy, any place like that, all the same?
They're everywhere, and there are different kinds of formulations. You can get a nasal spray. You can get the 4-in-1 flu shot. They now have a shot that does not go into the muscle. It's not as painful. It just goes into the skin. So there's a variety of choices that you have. But again, you have to weigh what risks you have. You have to weigh the options and make a decision. As I said, if you believe the science, the flu shot is the thing to go. And you know, with us all very excited and interested and preoccupied and nervous about Ebola and this respiratory virus that's spreading around the country, we are right to be focused on that. Those are big dangers. But remember, the flu kills more than 30,000 people a year. We should pay attention to that too.
Gotta go. Did you get your flu shot?
I haven't yet. I'm waiting till mid to late October, when my immunity will last through the end of the flu season, but I will in the next 2 weeks.
Okay, all right. Nick Tate, thanks for joining us.
My pleasure.
After this break, we're going to drag Nick out into the parking lot. We're going to give him his flu shot. It'll be live.